what I can say about the UT program, it has been an outstanding place to train. Some of my closest friends are here, and I can't imagine myself any other place.
We see such a diverse patient population that we're getting to experience any possible diagnosis that we could potentially see in the future.
We get a really good glimpse of what it is to be like a pediatrician in a clinical setting, outpatient, and then what it is to be a clinician, inpatient, working in a hospital.
I think that my residency program is currently preparing me for a wide variety of clinical experiences. I would feel confident that I've seen enough of these patients in the past that I would be able to provide the best possible care for them.
This has just been a fantastic place for me personally to train, and for those who choose to join our program to really develop themselves as pediatricians and pediatric subspecialists. And the reason I love pediatrics, I'm an outpatient general pediatrician, so I love longitudinal relationships. I love seeing a newborn become a toddler, being able to see not only this individual grow, but also seeing their guardians grow as they continue to raise this child, and then understanding my role in making sure that they grow and meet the best of their abilities and capacities.
Our interns, even though we haven't gotten to do a ton of things together in person because of COVID, we're still all very close in finding bonds between each other, just with who we're working with on rotations.
At work, we're always, even if we're not physically working side by side, we're always a text away. So if you have a question about a diagnosis or a treatment plan or management plans, we always text each other, we always call each other. The faculty members are all very approachable, they're very friendly, they're very encouraging.
Everybody that I interact with every day is so helpful. Even if it's a brand new person that I'm meeting, they are always going out of their way to help me if I have a question.
It's the unique combination of having excellent researchers, top-notch researchers, excellent clinicians, world-class medical educators, and then you're putting them all together in an environment where they're just also great mentors. My goal is to make sure I create opportunities for them, give them the skill sets they need to be able to succeed, and that matches their own personal goals for themselves. Not only am I going to give you feedback, but I'm hoping you also give me feedback, because I know that every innovation that we've had within our program has really been driven by the resident learners. So I think that's really important.
There's so many things to do in Houston, so much food to try and places to go see. Even though there's not a ton that you can do with COVID, we're still able to go out to all the parks and go walk around. The zoo is still open, you just have to make reservations. So there's still tons of things to do.
Houston is a great place to live. There are lots of housing options, so I know that that's sometimes a concern for residents, finding apartments or townhomes or condos. The parks are amazing. We have Herman Park right across the street from the Texas Medical Center where we work. I like the food scene. There are so many different restaurants and places to eat, and the food diversity is remarkable.
I think it's very interactive patient care. It's very patient-centered and family-centered in the Children's Hospital, so I think all of the attendings, as well as all the residents that I've worked with so far, do a great job of always making sure that the families are very integrated into the decision-making of how their child's being cared for.
This residency program, it really forces you to look at the patient as a whole. You take care of the patient's mind, you take care of the patient's ailments, whatever those problems may be, of course, but you also take care of the family, and you're teaching the patient, you're teaching the family how to better themselves, how to take care of themselves.
We typically rotate between either Children's Memorial Herman or LBJ. LBJ Hospital is more of a county hospital, so we do have experiences really providing care for people who are underserved and underinsured.
We also rotate as interns and second years at MD Anderson Cancer Center.
The experience I've had with my patients has been very uplifting and empowering for me. I became a doctor because I really do value the clinical experience. Both parts of the institution have provided me with a greater sense of empathy and compassion.
We have a strong emphasis on making sure everybody is okay. We have different groups that we've established on social media. We have texting groups that we have that we check up on each other.
I think what's great about our program is we want you to bring your authentic self to work. We create an environment where you are celebrated, not tolerated.
We have weekly wellness emails that we get about things you can do during COVID to keep yourself busy or to find ways to take your mind off of everything that's going on. The program itself does a really good job of making life fun in the hospital and outside of the hospital.
I'm actually applying to pediatric hematology oncology fellowship as we speak, so going through a very similar virtual process.
Really think about what you want as a career path after residency, and not every program provides the same types of experiences.
Go with your gut when you're going through all these virtual interviews, and know that for us as residents here, and I've gone through this program now over 2 years, it's a terrific place to train, and the faculty are outstanding. And I think a lot of us come out of it becoming great pediatricians or great pediatric specialties, whatever that is. And if I were to do this all over again, I would choose UT Houston all over again.
I definitely think the diversity that's present within Houston lends itself into the residency, which was really, really important to me.
You can become a good pediatrician at some programs. You'll become a great pediatrician here because you're going to be matched with mentors who are really invested in your success.
The next 3 years are really critical to your training. You're going to learn the most. You're going to work the hardest. It's going to be very challenging. You want a place where you get along with the residents. You want to go to a place that the faculty are very encouraging and advocates for the residents and encourage teaching and mentoring. And that is, I guarantee, what you're going to get here.